tomorrow marks World Health Day, which will be observed under the theme Healthy Beginnings, Hopeful Futures. This year focuses on maternal and newborn health. In the same vein, Stats South Africa has recently reported a steady increase in perinatal deaths. Professor in the Department of Nursing and Mid-wifery at the Faculty of Medicine and Health Sciences at Stellenbosch University, Doreen Kaura, joins us now. Good evening, Professor. Thank you very much for joining us on the program. So this year's World Health Day, as stated, will focus on maternal and newborn health, a necessary focus area, if I can say so myself, given the alarming statistics that every year 300,000 women die due to pregnancy or childbirth complications, and 2 million newborns don't survive beyond their first month. What can we attribute these figures to?
Unfortunately, there are several interconnected factors, and thank you for this opportunity, that contribute to perinatal deaths, especially in South Africa. The first one is the delays in accessing care, poor quality when the women come to us, antenatal, intranatal, or postnatal care.
Mm-hmm. Now, when
we need to improve on our health systems.
Mm-hmm. Pardon me for interjecting there, but just for clarity, when we speak now of the delays in accessing the care as women who are with child, what would be the issues there on their part? Is it ignorance to come a bit earlier, or what are the issues?
A lot of it is socioeconomic factors. It could be where the women do not have enough adequate transport due to poverty, or even lack of knowledge for them to be able to come to the facilities on time.
Mm-hmm. And then when we look at the maternal mortality, it has of course decreased, but the disparities still persist. We know that sub-Saharan Africa accounts for more deaths, 70% we believe. What more needs to be done in this respect, given that it seems the problems are well characterized?
We absolutely need to really focus on investing on training of healthcare professionals, especially midwives, who are at the core of maternal care. So deployment of competent and confident midwives, and the government need to focus on supporting and supervision of the care that is given in the healthcare facilities, especially the primary care level, where we have the highest number of women being seen.
Mm-hmm. But it seems now the social issues also continue to plague many in society, because here you're talking about the need to ensure that within the hospital space they are fully equipped. But then now what happens when you also highlight the fact that some of them don't have money to even get to the hospitals? That once those hospitals are equipped, how do we get those mothers to the hospitals?
We have been for a long time saying that we actually need obstetric focus on systems, trying to implement systems such as obstetric ambulances for referral, and ambulances which the women can call from the communities to be able to get to us. Yeah. But also community engagement, where women, families, and community health workers are working in collaboration with our facilities to be able to recognize and refer women on time and educate them on timely care.
Mm-hmm. So most certainly it will go beyond just the health department, but also the social services in this respect. But if we had to look at Sri Lanka,
exactly,
it has seen remarkable progress. What could many take from their reduced maternal mortality rate?
A lot of it is strengthening the health information systems, and I think Sri Lanka has focused on that. And when we speak about strengthening health information systems, it focuses starting from the homes, where the communities, the women in the partners also are educated on what is necessary when it comes to response times. Because if we don't focus on pregnancy and ensuring that pregnancy is well covered, then we are not able to, those are the babies that we are seeing in South Africa, that the highest deaths are on day 0. Mm-hmm. And if they don't die on day 0, they die on day 1 to 7. And this is because of pregnancy complications mostly.
And then broadly speaking, the importance of this day itself, observing World Health Day. How important is it to actually highlight some of the issues even beyond what the focus area is this year?
World Health Day, for me, when I realized that the World Health Organization has actually given maternal and newborn care that kind of focus, it means the health of a nation is determined by our future, and the newborns are our future. So how do we educate our communities, our society, that it is imperative to ensure that we invest in maternal and newborn care? Especially in South Africa, where we have very limited access to quality maternal newborn in some remote areas.
Professor, thank you very much.
It is about time we think about these newborns, our futures and tomorrow, and we can't afford to ignore them.
Most certainly. Professor, thank you very much for your time this evening. That's Professor in the Department of Nursing and Midwifery at the Faculty of Medicine and Health Sciences at Stellenbosch University. Doreen Kaura speaking to us there.